Hello and welcome to Module 2, Lesson 2, Team Members and Roles. This is the second lesson in the second module of the Integrated Care for Behavioral Health Paraprofessionals course. The course has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. Purpose. This lesson describes the typical members of an integrated primary care and behavioral health team and the roles that each category of team member plays. Lesson objectives. Identify typical members of an integrated care team. Describe the roles and responsibilities of each team member. And describe how team member roles come together to create a system of care. Keywords include co-located and discipline. Lesson outline. We'll cover the following topics in this lesson. First, we'll look at the typical team of integrated care team members. No members themselves are typical. The team member roles and responsibilities, and finally we'll have a chance to take a peek at a video of a high-functioning integrated care system. We'll recap everything with a lesson summary, offer a few resources and references, and then don't forget to check your understanding at the end of the lesson with a short quiz. You may take the quiz as many times as you wish, but you must score 80% or higher to move on to the next module. Integrated care team members. Integrated care teams are flexible and dynamic. The best teams are built in response to each patient's and family's needs and involve professionals from across disciplines. A team can be large or small. It all depends on what the resources are, your area, and what the patient's needs are. In a high-functioning integrated settings, communication between team members is continuous, organized, documented, and shared appropriately. This is key to how any roles and responsibilities play out because everyone is responsible for that core skill of communication. Definition time. Co-located basically means that providers and other healthcare workers are located in the same physical space. Ideally, in a high-functioning model, core team members sit together in an open workspace and communicate constantly to ensure that patients are receiving the care they need. Alternatively, telehealth can be used to integrate care when services are not physically co-located. Here are some of the typical integrated care team members. The team owners are always the patient first, followed by family and caregivers and other support systems as identified by the patient. But the patient is always at the middle, the center of the team. Primary care is an important element and includes generally a physician or physician assistant or nurse practitioner, nurse, medical assistant, and often there are many other people ranging from a phlebotomist to office staff who work in primary care centers and are essential team members. Behavioral health consultants may be there may be more than one involved in the care of the patient, depending on the situation. But some of the different roles you may see there are a psychiatrist or a clinical prescribing psychologist, both of whom can prescribe psychotropic medications. The clinical prescribing psychologist also provides therapeutic support. A psychologist for therapeutic support, psychiatric nurse practitioners can also prescribe meds and often can provide a holistic sense of care. Licensed clinical social workers, mental health, substance abuse counselors, peer support workers, and other behavioral health paraprofessionals. The list goes on But the point is that multiple behavioral health professionals and paraprofessionals may be involved in the patient's care. Allied health professionals are also key members of the patient team. These include health educators, care coordinators, depression care coordinators, community health workers, the promotores de salud, patient navigators, pharmacists, dietitians, physical or occupational therapists. Many of these people are key to helping someone get literally back on their feet and healthy again. And don't forget the role of administration as team members. Front desk staff may be the first person and the most frequent person that the patient talks to. Medical records can help the patient to assure that they have enough information to share with the providers who need to have it. Financial management is also key. As we're looking at the roles of the care team members, remember the team owner is always the patient first. Other owners are family, caregivers, and others chosen by the patient, but the patient is always at the center of the team. Paraprofessionals serve as the bridge between team owners and other team members. Behavioral health paraprofessionals specifically may work with other team members to provide support and advocacy for the patient. The paraprofessional role is explored more thoroughly in Lesson 3. Section 3, Team Member Roles and Responsibilities. The one key truth about roles and responsibilities is that they must be clearly defined for the team to function effectively. In addition, team members must understand the unique role of each member. Roles may vary in different settings depending on the size of the practice, level of integration, complexity of the patient's needs, and other factors. Regardless, all core members work together in relationship to help patients achieve overall wellness. Other providers and care workers can be added to the care team when needed, permanently or just for a temporary time. Again, here are some of the team member roles and responsibilities that I'm going to review real quickly here. Patient, primary care provider, behavioral health providers, medical assistant, care manager, nurse case manager, dietitian, pharmacist, and some others. The roles and responsibilities of the patient. The patient is the primary team owner. Secondary owners are people who comprise the patient's natural support system. This can include family, friends, whoever the patient decides to invite. The patient works in partnership with healthcare providers to decide what outcomes can be achieved and how those outcomes will be pursued. Patients and family caregivers share insights and context about their needs, goals, preferences, and experience with healthcare providers. In return, their perspective is respected and valued by all team members who engage patients in shared and personalized decision-making. Always remember, the patient's concerns are the team's concerns, no matter how silly or ridiculous those concerns may seem. This chart shows the roles and responsibilities of the patient at different levels of patient engagement. The more traditional model is on the left, with the model of the highly engaged patient is on the right. So if the patient's role in relation to the team is simply being a care recipient, so something's done to me if I'm the patient receives services from members of the healthcare team, and that's about it. The more engaged patient, a care participant, which basically means we're doing it with you, the team provides care and the patient cooperates on relevant care processes. In the highly engaged setting, this highly engaged patient has become the care partner or owner, and so the care is driven by me. The entire team, including the patient, agrees on each team member's responsibilities. And the patient is a key piece of that. They're not just an afterthought or told what to do. And that's what's really important. Likewise, there are 3 levels of information flow. from the patient providing information and receiving instructions, to patients and team members each contributing information to guide care decisions, finally to information exchange where team members reflect back and explore shared information to achieve mutual understanding and clear expectations. Decision-making is another area that falls along the spectrum of patient engagement. At the lowest level, health professionals create a care plan and give it to the patient who may or may not follow it. At the next level, the care plan is developed together and includes patient goals, but lacks patient-focused roles and responsibilities. At the third level of patient engagement, there is mutual agreement on the care plan and related decisions, including shared accountability for outcomes. The primary care provider is another essential team member. The primary care team is led by the primary care physician, and who is also responsible for initial assessment and diagnosis of health issues. The PCP sets plans for follow-up on known diagnosis where treatment is stable, and adjusts treatment plans for known diagnoses when goals are not being met. Behavioral health providers. Several behavioral health providers may work with the patient. Generally, these are licensed mental health professionals. However, many behavioral health paraprofessionals are also engaged. They may provide screening, assessment, brief interventions, education, and follow-up to patients. In a highly integrated setting, the behavioral health providers are co-located with primary care providers. Some typical roles: psychiatrists consult with primary care physicians about psychotropic medication management and patient treatment, supervise care managers and paraprofessionals, and provide consultation on difficult cases. Clinical prescribing psychologists may prescribe medications in addition to providing diagnoses, therapeutic support, and supervision of care managers and paraprofessionals. And finally, behavioral health paraprofessionals, I'll use that kind of catch-all term, work with patients to help them address health and social needs. They educate other team members about the patient's needs, circumstances, cultural mores, and more. Another critical person on the team is the medical assistant. The medical assistant helps patients check in, takes vital signs, provides screenings. He or she sets up procedure and rooms. Immunizations, venipuncture, and medication administration also fall underneath the rubric of the medical assistant. And finally, they manage the daily schedule and conduct preventive screenings for things like tobacco use, depression, are you feeling safe at home, etc. The care manager enrolls patients in services, completes patient intakes, provides patients with screening tools, and follows up with patients to discuss treatment adherence and any barriers. They provide ongoing case management and coordination, monitor treatment and outcomes, and provide support to patients during treatment. Finally, they'll facilitate referral to specialty care or other community resources as needed. The nurse case manager has a slightly different role. First of all, the nurse case manager makes sure all patients have teams assigned that meet their needs. They help patients to prevent and manage chronic disease. Often the nurse case manager works outside the physical visit, so they'll handle things such as patient education, labs and radiology reports, medication refills, and follow-up visit requests. Dietitian has to be one of everybody's favorite people. Consults with patients and families both in person and by phone. They offer assistance and education about healthy dietary choices, and consult with the primary care team regarding the patient's conditions. Finally, provide support through various programs and classes. The pharmacist will provide the care team with information about evidence-based, cost-effective medication usage. They may consult directly with the patient, helping them to reconcile medications and understand how to take them for the best therapeutic effect. and they'll meet with other team members before and after patient visits. The pharmacist is key as medication after medication is poured down many a throat. We need to be sure that all of those medications are in balance and won't harm each other, but will do the most good. Other team members may be called in to help with specific needs. The expanded care team specifically might include members from other settings of care, such as schools, specialty practices, hospitals, skilled nursing facilities, community service providers, and so on. Finally, a high-functioning integrated care system. I am going to pause and allow you to click on this video, and pause this video and let you click on the video in the PowerPoint. It's also available in the course content page. Just take a few moments to review this quick video and offer up a few comments on it. Lesson summary. Integrated care teams are flexible and dynamic. They are built in response to each patient's and family's needs. They often involve professionals from across disciplines. Communication is continuous, organized, documented, and shared appropriately. Ideally, care is co-located. Core team members sit together in an open workspace and communicate constantly to ensure that patients are receiving the care they need. Telehealth can be used to integrate care when services are not co-located physically. Some typical integrated care team members include the patient, always the owner, primary care workforce, behavioral health care workforce with multiple different roles, allied health professionals, paraprofessionals, and administrative and management staff. The roles and responsibilities of each team member must be clearly defined. Team members must understand the unique role that each member plays, and remember that roles may vary in different settings and for different patients. Core members of an integrated care team work together in relationship to help patients achieve overall wellness. Other providers and care workers can be added to the care team when needed. Some key players include that patient, primary care provider, behavioral health providers, including a consultant, psychiatric or clinical prescribing psychologist, other licensed mental and behavioral health professionals, and behavioral health paraprofessionals. The care manager, nurse case manager, dietitian, pharmacist, and others, including professionals from other settings of care. If you'd like to learn more, a couple of resources include the AHRQ Integration Academy and NAMI. This is a link to a blog, but they have multiple resources on mental health care, primary care, behavioral health care integration. Some of the references used for this presentation include the following. And don't forget to check your understanding in the course self-assessment. You may take it as many times as you wish, but must pass with a score of 80%. The Integrated Care course is brought to you from the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, with funding from the Health Resources and Services Administration. Thank you for your time.